Hi, and welcome to What's Happening at Tri-City Medical Center. I'm Kellie Davis, and I'll be your host for this edition of What's Happening, made in collaboration with KOCT, North County's channel, and the Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center and provide you with information on a healthy lifestyle. Joining us on our show is Dr. Hanna, General and Bariatric Surgeon at Tri-City Medical Center, here to talk about the complexities with obesity and weight loss. Obesity, or rather unhealthy weight, is considered a disease, and not just a disease in itself, but one that lends to other health issues such as high blood pressure, diabetes, heart disease, infertility, shortened lifespan, increased risk of certain cancers, and many other healthcare concerns. It is on the CDC's top 10 list of most important health problems in the U.S., and it's rapidly rising disease. We welcome Dr. Hanna to speak about this very important issue. Dr. Hanna, thank you for joining us.
Thank you. I'm very happy to be here.
I know we took you away for some patients, but this is really important stuff.
Yes, it is.
Well, first of all, I have never heard the term general and bariatric. What does bariatric mean?
Bariatric is basically weight loss surgery. So it's one and the same. Bariatric surgery is the same as weight loss surgery.
Okay, so $1,000,000 question, Dr. Hanna. Why is it so hard to lose weight?
Well, that is a $1,000,000 question. If we had perfect answers for that, we would solve the problem. However, it's very multifactorial. And first, we all know that there's a lot of external reasons in our country, such as the increase in fast food. Fast food is often cheaper than healthy food. Our increasing sedentary lifestyle, the increased use of computers, streaming, television, instead of activity. But there's now an increasing recognition that there's a lot of internal factors as well. And that's where we came to the conclusion that obesity is a disease. What we know is that people who are at an unhealthy weight have different genetics than people who are at a healthy weight. They have different hormone levels. They likely have higher levels of the hormone that make you feel hungry. They have lower levels of the hormones that make you feel full. They have some psychological reasons that play a factor that we're still understanding. We also know that people who are at unhealthy weight, when they go to the gym and work out, even if they do the same level of exercise, reach the same level of heart rate, their body does not burn as many calories as somebody at a healthy weight. There's an increasing interest in the idea that the body has a set weight that it thinks it's supposed to be at, and as you gain weight, the body will reset that set weight at a higher weight. So when you try to lose weight, the body does everything possible from making you feel like you're starving to burning less calories in order to keep that weight at that set point.
And I know there's compounded with, you mentioned going to the gym, but I know that there are so many diets out there. There's this diet, there's that diet. So which one should we be doing?
I get that question a lot, actually. So yes, there's all kinds of different types of diets. Some are low fat, some are low carbohydrate, some are high protein. Some actually have a balance of fats, carbohydrates, and protein and use point systems to help you keep your calories low. What we know is that they all have about the same effectiveness. In other words, if you do scientific studies, the average weight loss on any program is about 15 to 20 pounds, which is great. It's certainly a step in the right direction. However, for somebody who's already 85 pounds overweight or even higher, it's not going to get them to their goal. We also know that only about 10% of people who do any of those diets manage to take the weight off and keep it off in the long term. So they're not terribly effective.
So with all the diets that are out there, as a doctor, do you tend to recommend one diet or another, or I guess you can't do that, huh?
No, it kind of comes down to what people's tastes are. You know, if people and what they're willing to follow and what they're willing to stick to, what program works best for them. So it's really up to the individual patient, because they all have about the same, like I said, about the same effectiveness. No one diet is better than the other. They just need to do it in a healthy way. They need to have routine follow-up, and it's certainly the best place to start. But again, keeping the realization that outside of a very few people, they're not going to be effective in the long term.
So when someone comes to you and says, you know, I'm thinking about having one of these many different kinds of surgeries, what is the first step that you recommend when someone's like, I want to get this thing off me?
Right.
What do you?
Well, first of all, surgery shouldn't be the first attempt at weight loss. There should be use of one of those diets that we talked about, an attempt at medical management. The other thing is that surgery isn't used for losing 20 to 30 pounds. There are criteria that are used to determine if somebody is a candidate for surgery, and that's based off of what we call a body mass index. Body mass index is a calculation of height and weight. You can do an online search. There's BMIs, we shorten it for. There's BMI calculators online where you can put your height and weight in and it'll calculate for you. If your BMI is 35 or higher and you have medical problems such as the ones we talked about earlier, diabetes, high blood pressure, then surgery would be a consideration. But for a BMI less than 35, then usually we go with a non-surgical route.
And in Tri-City, is it that are you seeing people as a referral to you, or are they actually coming in to you first when they think about this?
There's a variety of ways they get to me. They can self-refer. A lot of times their primary care physician will refer them to me. It kind of depends on their insurance, whether or not they can come see me, and have it, have their insurance cover it. And then I do an evaluation on whether or not they're a good candidate for surgery, whether they meet those criteria, what's needed to prepare for surgery. And then ultimately the surgeries are then done at Tri-City Medical Center when we get to that point.
And we talked about the diets, and I know some diets actually use medications as well. So what is the position on using medications for?
Well, medication should be physician monitored. There are a number of medications that have been FDA approved for weight loss. They all have slightly different ways in which they work inside the body, but they ultimately decrease hunger and in some cases decrease cravings. Mm-hmm. So they're kind of an addition to a good diet, and an exercise program. The problems with medications is that they add maybe another 20-pound weight loss on top of diet and exercise. They do need to be used for long periods of time. They can be expensive if their insurance doesn't cover it. And ultimately, when they come off the medication, they're at high risk for regaining the weight.
Okay, well, thank you. We're going to be right back. We have Dr. Karen Hanna here, general and bariatric surgeon at Tri-City. We'll be right back to talk about surgery.